So when I get asked, when I work one-on-one with my clients, they often ask me, how do I know if it's OCD or something else that's going on in my life? It's very important that you see someone that can properly diagnose you and who is an expert in the realm of OCD. So you know exactly what the symptoms are, and they're able to explain it to you very thoroughly. But let me just start with a few things that are necessary to be able to say, yes, it is OCD. So the O in obsessive-compulsive disorder is the obsessions. Now these are reoccurrent and persistent thought or urges or impulses. Now with these thoughts, urges, or impulses, there's a lot of intrusive thoughts and that are unwanted and intrusive unwanted anxiety. So these are really important to know that the person does not want to be thinking about this or having these impulses going on in their mind over and over. So what we tend to do when we have an obsession is we try to suppress it. We try to ignore or neutralize it. But what we actually do is make it worse when we try to do that. Now, when we're doing the suppressing, we try to distract ourselves or think of something else to take the place of the unwanted intrusive thoughts. So one of the ways that we bring down the anxiety caused by the obsession is we do a compulsion. So think of the letter C. A compulsion or ritual, those words are used interchangeably. Now with a compulsion, it's a repetitive behavior that we do to decrease the anxiety. So let me give you an example. It can be an outward behavior or it can be a mental behavior. Now mentally, if someone is doing mental compulsions, it's a little more difficult to detect sometimes, but a mental compulsion might look like something where a person is counting to a certain number or counting in 3s, 6s, 9s, or they're praying. They may be praying a certain prayer over and over to neutralize, to cancel out that obsession so that they don't have that tremendous anxiety that the obsession brought on initially. Now, all of these obsessions that are triggered, the compulsions, all the compulsions are ways to prevent the dreaded thought, situation, or event from occurring. So it's kind of magical in the sense that if we do this, we'll cancel out this. And we realize living with OCD, I know I did many times, is that it didn't make a lot of sense, but it was necessary to follow through with the compulsion.